Hello, I am Rogerio Pinto, and I am the Associate Dean for Research and a professor at the University of Michigan School of Social Work. Last spring, I began a series of online forums about the COVID-19 pandemic and issues of stigma. Who was being affected by the pandemic? How were they being treated? What abiding inequities were suddenly being highlighted by the pandemic? On March 25th, 2020, an African American man, George Floyd, died at the hands of Minneapolis police. This event was almost immediately recognized as a turning point for race relations in this country. Soon after, I invited two social work leaders to discuss the idea that social workers should collaborate with law enforcement. Even before we held this discussion, the topic revealed itself as a far-reaching one, and I began to put together a second discussion, highlights of which you will see here. I hope we will enjoy this rich and far-ranging discussion. I would like to thank all of those who originally participated, and I thank you for watching.
Essentially, I want everybody to know that my history with law enforcement has been very volatile in the past. So a lot of people know that I have a son that's been incarcerated wrong. He's incarcerated for a wrongful um, um, jury verdict. I've been assaulted by a police officer. I've been in jail myself and been incarcerated. So, and long trips of visiting my loved ones in prison my entire life. So I just want to give that background that I would probably be the least person I would ever think that would want to develop any kind of rapport with law enforcement because they have not in the past been intimately supportive of me or my family. So I want to preface it with that. I want to say that as I've been doing continuous work with the African Center, with the new leaders at African Center Social Work, one of the things that has been very clear to me is that a lot of the ideas that I carried around with me, even not liking police or not liking or wanting police to come when I had an issue, really were rooted in white supremacy. I think that the criminal justice system is rooted in white supremacy, and it doesn't really fall in line with my natural idea of that we're all a collective being and we're only as strong as our as a person that has the that needs the most support. And so, from recognizing that I can say I want to be African centered, but then I'm still operating in a really Eurocentric and cancel culture type of way, made me start thinking about how do I navigate in different spaces in my world. And also thinking about where my sphere of influence is. So, as a behavioral health professional, one of the things that I've been really thinking about is my son. I was really concerned once when we had to call the police about his mental health challenges. We didn't want to call the police. We actually wanted to call mental health services or ambulance, but the first people that came were the police. And how that disrupted a lot of my household. So, and just so you know, yeah, so I have a black son. I should say that. So, thinking about those things and recognizing what is happening in the world, because I think a lot of people have this idea that they know what's going on. And I realized that I really didn't know what's going on. And I thought I had a lot of ideas of how to fix things and all these things. And then I ended up finding out that, oh, guess what? When you do a assessment, you'll find out that there's a lot of things happening in the community that you don't even know about. And I was introduced to the crisis intervention team that is a program that's focused on training officers and being able to engage with community members using a trauma informed policing approach, but also building community connections with the mental health providers. So, in both trainings that we've been in, that I've been in, have been a combination of behavioral health providers and law enforcement and learning from each other. From that, I've been really mindful about the fact that the same way white supremacy is impacting me, my field, it also impacts law enforcement. And I've been so, in the past year and a half or so, I've been working with the chief who was going to join us, but he had a family emergency that has been really doing a lot of things in Northfield Township and really wanted to do things before things got into. So I'm talking like 2 years. We've already been having this conversation. And so I'm really glad Officer Domzowski is with us so that he can share the things that that Northfield has been doing over the past couple of years.
Absolutely. Well, first off, thank you for having me. And second off, I'd like to apologize for the camera issues here. The building I'm in keeps dropping the call, and I didn't want to be rude and have it come in and come out. So I do apologize for that. To touch on what Daisha was saying, I had the pleasure of working with her last week. We're actually instructing for the CIT. And just to build off of that, essentially what it is, it's an innovative first responder model of police-based crisis intervention. And what that does is it's training to help us for persons with mental disorders or addictions and allow them to access medical treatment rather than place them in the criminal justice system. I kind of had, to touch on that, back in 2016, I look back on that and I reflect upon responding to somebody who was suffering from mental illness and not really understanding that it kind of took a turn for the worse, unfortunately, where I was injured. In that moment, I realized the importance of having crisis intervention teams and having mental health professionals integrated with law enforcement so we have a better understanding of what we're dealing with out there. For Northfield Township, just to kind of speak on that, our focus here is just best practice standards. We work with the Michigan Association of Chiefs of Police. We also work directly with High Garrett Health and COPE. But we're also working with the Detroit Wayne Integrated Health Network to try to build a better relationship so that way we do have a better understanding of mental health in the community. The goal here is to leave a positive footprint out there in the community and leave people with a positive experience instead of a negative experience, especially now with the climate of what's going on around the country. My spouse is a social worker, so I have a strong love and passion for social work. So for me, I don't want to say that I'm caught in the middle, but I know the importance of having social work with law enforcement and having that understanding with the mental health aspect of it. I think it's imperative that every law enforcement agency has that and has a positive relationship with them. It's just better all around for every community that we're involved with.
Well, what I would like to suggest actually is if there could be a helpline in the police station so that if somebody calls and maybe they just have a question or they need some advice before it becomes a 911 call, and to discuss it so that somebody who's feeling troubled doesn't necessarily have to have the police come to their place, you know? I mean, I would like to see that happen. Ideally, I would like to be able to de-escalate and prevent, you know, because basically in my experience, you know, the detectives would come and spend quite a bit of time with us when they were trying to find a perpetrator out in the streets. And so to go through our film and discuss, and that was very alarming to the people in treatment there because they wanted their privacy, you know, so it can be complicated. So many ways that we could de-escalate rather than have to react after an event, you know, that's what I would like to see happen. Yeah. The social workers already know the policemen, so they know who to call, what to present, and how to get help for the people prior to having to go in and make an arrest, you know?
Right, because Regina, one of the things that you're mentioning, and this is where I think the clinical pieces come, there's two pieces. One, we have to ask ourselves, why do people not call social workers when they're having a mental health crisis, right? So why are the clients in the community, not reaching out to the service providers, because here, and I know every state and country and local place has their own thing, but we have a 24-hour crisis line. We have a crisis mobile response team that will come out. We have all of those things, but people don't call them, they call the police. And so to me, when we talk about this thing about social work, there's still a huge distrust of social workers in the community, and it's preventing them from wanting to deal with us. So this whole thing that people are thinking is a great idea is actually, it has to be combined, because we have to all do our work to say, well, why aren't people calling mental health professionals? They know they have a lot of the people have a mental health professional, have a clinic that they go to, but their family and they are still calling 911, and here come the police. So when people are talking about defunding anything, at a talk we had that in Livonia, Officer Domzowski and I was there, and what people were really saying, some people said, don't defund anybody. Fund both places to their full capacity. Fund mental health so that we have more accessibility. Fund police to their fullest capacity so that they can be trained. And it's not about defunding one or the other, but making sure both entities are able to function in their best way. And so, Regina, I definitely appreciate you saying that, but I know we have all of those things, and people still call 911 because that's who they look to provide safety.
Right. We have some cleanup to do because sometimes social workers are thought of people that, protective services has been called and their child ends up being removed. And there's a lot of stigma that, and a lot of work that we have to do to inform the public as to what our multiple roles are. And even we don't really know, and the police doesn't really know always what the troubled areas might be, who might be in trouble. So there needs to be more communication between the community and all providers.
In regard to the question about white supremacy in these spaces, I think that it's very difficult in this country for people to be accountable to history because we are in a very individualistic place. So no one wants to take responsibility for what they feel that they didn't directly do, but white supremacy does permeate all of our system. So this country was stolen. The people who began this country did so off of stolen land with the labor of African people who they kidnapped and enslaved. And we see the lasting impacts of those actions through intergenerational trauma exhibited in communities of color, particularly Black and Indigenous communities in the US. And you can look up statistics on that from a wide range of things. So that's the first thing I think that needs to be acknowledged, and in whatever field that we're in, that white supremacy is the default. And until that can be accepted largely, I personally do not believe that we will see large scale changes. And then, so as it's been alluded to, social workers and law enforcement officers have had a violent history of harming communities, particularly Black, Indigenous, and communities of color. And having us team up, I think will actually lead to an increased lack of trust if we don't do what Daisha was mentioning, which is really, really do the work and figuring out where that mistrust comes from.
When a 911 call comes into Northville Township, we respond to every call for service. We don't turn down anything. So we always respond. And as it relates to anything where it's a mental health crisis, we have a mobile crisis team, and that's exactly what Daisha was speaking of. We work directly with Hagera Health, and we also work with COPE. What COPE is, it's a community outreach for psychiatric emergencies. That mobile crisis team is activated in the event that somebody is in a state of crisis, and we'll have them come out, social workers, to speak with them on the spot rather than try to take action ourselves. But with that being said, we also have the crisis intervention team, which the goal here is to train all of our officers in crisis intervention to be able to de-escalate that situation rather than have any type of incident turn into a hands-on situation. It's about diversion here. We want people to get the help and the resources that they need rather than go to jail. Jail isn't going to do them any justice. They need the proper resources in order to better themselves. I do pride myself on that, being the CSO here, and our chief is very progressive in trying to make a change, and I'm grateful for that. So when you're speaking to the 911 calls, again, every call that comes in for us, it can vary. I mean, it could be a suicidal subject. It could be a domestic violence altercation. And if you're speaking on the idea of a social worker responding to a potentially violent situation, and if your question is, do I feel safe with that? I would have to say no. Having a spouse in social work, I don't think that I would ever feel comfortable knowing that my wife is going to what the call taker says is not violent. Any situation can become violent, and at what point, what is going to happen in that situation when they're there without anybody else? So again, I'm kind of caught in between on that. And maybe Daisha can touch a little more on that, again, being a social worker and how she would feel responding to something like that. But that would be my take on it, sir.
I think that it's really about understanding what are some of the root issues and challenges that people present with. I would personally feel very comfortable intervening in a crisis with a client that was my client. I think one of the things that I was asking Dominique about was consider, and Regina, is about the training that clinicians have and social workers in general is that if anybody tells you they're considering suicide or anything like that, is to automatically call 911. And so I'm just looking at people and I want to know, have people told you, or have you heard people, have you been trained that if someone is feeling suicidal to call 911 to get intervention? You shake your head. Not my students, but other students. Y'all not saying anything. So I wonder, what does that mean? Have you been told anything, or what do you do? So I know in my practice settings, there's literally been places that say for the professional, if someone is reporting X, Y, and Z, call 911. When you call 911, unless you are connected to a program like Officer Domzowski, it can go a number of different ways. And the problem is that the community doesn't know what that looks like. So they just call the first number that they can access and the people who have to come. Because they don't have time for social workers to be like, well, I'm with my family, or people don't have time for that. And so do I think that community response teams should be something? I absolutely do. Because I think if people could actually come out and ask people what is happening right now, and it may not just be mental health as far as mental illness, it may be distress because of other life stressors. And I think that's another thing that I want to make sure we're differentiating. I think of mental health as all mental health and behavioral health, not just having a severe and persistent mental illness. So if someone has no food, if they have no clothes, if they've just been put out, those are all community issues. And Alicia was just sharing that her husband is a Black officer. So they were trying to do the right thing, right? They were trying to connect people to resources, but if they're not there, what do you do? So I think that when we start to ostracize ourselves and have all these little fragments of pockets of things that we do, we are perpetuating, as Dominique said, individualism. Even as a profession, we're perpetuating individualism and saying, well, I'm going to do my thing, you do your thing. Interprofessional work means we need to know our expertise, but we also need to collaborate in really strong ways. And what I will also add is that I'm going to say anyway, Northfield Township is a predominantly white place for people who don't know. So and I will also say, Jimmy, yes, they're all the officers in Wayne County have access to mental health first aid. I have been training officers in mental health first aid in Wayne County for the past 3 years. We saturated them with that. The Northfield Police Department or police agency is a resource, I would say, has forward thinking people, right? So this is somebody who took time out of their day to stand there for a chief. The chief was going to join us. They want this so badly. So of course they're going to be the ones that's connected to all these places, but nobody hears about them. They hear about the place that's under resourced.
One of the suggestions that I have now is to include the schools, like when children are 10 to 15 or whatnot, to have regular meetings, regular curriculum where social workers are invited, a police person is invited, and their full discussions as to what the issues actually are in the community, because I think we have all stated that there is a bit of a cloud, we don't really know sometimes what the issues are. So how are we going to know how to handle them? So additional research means getting to know the communities, the schools, the hospitals, the stores, the shopping areas more thoroughly, and to bring the community together. Otherwise, we all fall into separate pieces. Yeah. And make it part of the curriculum starting early, with kids 10 to 15. What are the issues that stop them from doing their homework, from getting up on time? What is it that brings up anxiety? What is anxiety? It's like children often don't know how to talk about that. So hand them the language, to facilitate communication. I think we all need to grow for the system to work. Otherwise, we're just taking care of separate pieces. Bring in an example, bring people from the community to the classes, let them tell their stories, let them tell what helped them, what worked, and what didn't. Clinical work is not just about talking about dreams, it's talking about every day. Are people getting enough food? What do people who are not getting enough food end up doing? And and what can we do to prevent that? Prevention, I think, information, prevention, education, it has to come first before there are tragedies.
For people who are clinicians, one of the things that I've been trying to share with them is, can you also use your clinical expertise to work with officers, right? So I do have some former scholars that are employed that or are or have been employed by police stations and agencies where they are specifically there to support the officers. Because I think we often forget that a lot of the responses from officers, when you talk about human behavior, has a lot to do with training and the experiences that they've had. So when somebody responds reactively in a crisis, we want them to be ready, but you have to remember they live 40 hours a day, oftentimes in fear of what they're going to approach. So human behavior in a social environment says, I'm going to be on guard every time I walk up. Why are we expecting them to do anything different without behavioral health support? So as clinicians, I implore people to think about, how are you going to support the officers that have seen all of these different things and being able to cognitively structure their thoughts so that they can actually be effective? How are you going to support these officers' children who have been bullied because their fathers are police officers, and that's going to impact? You think they're going to like you? No. You think they're going to like other people if all we're saying is that their fathers and mothers are awful people? What do you think that does to a child's human development? Right? We have to be careful about all of these things that we're doing, and how even just thinking, oh, quick fixes, tear up the police department, just do, okay, yeah, that's what we'll do. So I just want to think, as clinicians, it may not even be about what you might do in a public behavioral health system. You also have to remember that there are officers' families that need behavioral health services. And are you going to be ready to even challenge them or help them to see the discrepancies in their thought process when they come in and say these things that are problematic?
Yeah. So first, I wanted to address just the way we learn about the brain in behavioral health services, mental health services, from a social work perspective. This, I know this book is new, but I learned about dealing with people in a person and environment way, an ecological perspective in social work. So I pulled up the wellness wheel. People have their physical health, their emotional health, environmental health, financial health, occupational health, social health, intellectual health, and spiritual health. So we can't continue to divorce behavioral health from all the other aspects of people. And I know we have people who have been clinicians far longer than me here, so I'll put a pin in that. In terms of white supremacy in law enforcement and in social work, the open letter that kind of launched this conversation that you sent us said that as an evidence-based profession, social workers, we need to acknowledge that there is no evidence that reform strategies such as bias training can eliminate lethal use of force against Black people or reduce racial disparities at every level of the carceral system. And in some research that I did during the program on this matter, I learned that US officers shoot and kill more individuals than their counterparts in other countries. And it is also proven that Black Americans are disproportionately affected as perceived threats by police officers. So not actual threat, but perceived threats. Um, and this is not surprising based on what we're seeing. There was a gentleman in my father's Facebook comment saying, not all cops. And I said, well, where are all the good cops when this is happening? Where were the good cops when someone had their knee in George Floyd's neck for almost 9 minutes? The United States police force are inherently rooted in social control and benefit those in power. And it was not rooted in protection for all. And so what I'm always getting at is like the roots of it. And so, yes, we can do all of these things. And we also need to understand that policing in the United States was birthed from a need of public order, driven by economics and politics. So those with the means to fund their personal security needs decided to save money by convincing other citizens to pay taxes to create the police force. And throughout the Reconstruction era, local law enforcement continued to oppress the formerly enslaved Africans by stifling their emancipation, enforcing segregation, and people were either murdered or terrorized when they tried to report police misconduct. And so those things continue to happen. Today, FBI data exposes that Black Americans in their neighborhoods continue to not just be over policed, but targeted. And data displays that Black people are not more likely to use or sell drugs, for example, but they are more likely to be arrested for having them. So when we talk about policy efforts, the body cameras are taken off often, the volume is turned down. And so we really need a serious reckoning when we look at how much money is spent on the fiscal year of 2020 in the Detroit Police Department. It's $317 million. As it's $317 million. Housing gets 22.5 million. Health gets 12.7 million. So for me, I don't think it's egregious or inappropriate to say, what are we doing with all of this money? Like 317 million versus 12.7 million for health. There is a disparity there. So what would it look like if we were not funding military armor for police officers, because that is what has been being worn during these mostly peaceful protests? What would it look like if we were not militarizing our police and using maybe some of that money for military gear to reinvest in community work that was working before that was defunded? I think even before the Reagan era.
Well, I'd like to start first off by telling you, as I was listening to that, nobody dislikes a bad cop more than a good cop. And unfortunately, right now, there are thousands of police officers that are looking at the incidents that have occurred and are disgusted and appalled by that. And that includes myself. So I need to just make that very clear that what has taken place, especially with George Floyd, is wrong. That is not the way we are trained. I know at Northwell Township, we are not trained in that fashion, nor would that happen. So I just want to make that very, very clear before I even start. On the other side of this, as far as talking about social workers and law enforcement, and I understand that there's going to be opinions on both sides, I know that there's going to be people who don't agree with law enforcement, and then there are going to be those that do. I have the utmost respect for social workers because I've always had a positive experience with interacting with them and working with them. Based on what we're doing here in Northville Township, it has been a blessing working with the social workers and having the community outreach in order to be successful in responding to critical incidents and those that are in a state of crisis. Again, this is myself saying this, but I think that this works. I think that having social workers and police officers working together hand in hand not only is better for the community, but it's going to provide more resources, and it's going to allow a better understanding of one another, how we operate, and perspective. And I think transparency is key here in order for us to go in a forward direction and be more progressive. And how do we make a change, not only within law enforcement, but as you speak of social work in itself and white supremacy all around. We have to start there. I think that that is absolutely critical.
So for me, I think I know people are saying I want to do and not just talk, but I think talking is what helps people be able to do. And for me, spending a lot of time with officers, this the past 2 times I get the opportunity to ask them, why do you stand this way? Is that a part of your training? What is your protocol? What is the history? Tell me, what is the expectation? What do you expect about your position? I never knew any of those things. And to be able to know like what they feel their goal and mission and values are, and to really have a good understanding of that and how to collaborate, because they will tell you how to work best with them. Just like we do when we're trying to do interprofessional, I think we need to envelope that into interprofessional training. We do it with doctors, nurses, we need to do it with law enforcement too. And I do say that, and even though but I don't, if we're going to have law enforcement, that's what it's going to take. Ideally, I would say that each and every one of us have to think about, what do we feel about punishment versus restoration? Because at the end of the day, when we talk about law enforcement, that's the bottom line. There's many people that do not, that y'all couldn't live without police. See, I could live without police. A lot of people, we had the thing in the school of social work. They want to call the police old people. You want the police to do what you want them to do, but you don't want to do what they feel like they need to do. So having that combination of conversation to understand the purpose and the values would be tremendous, and to even know why they're doing what they're doing. So there's this stance where they put their their thumbs in their whatever they do. I've learned now that there's a reason for that. Like, there's a literal reason for every single thing that they do. And when I know it, I feel more comfortable and I don't have to be on guard.